Hi, welcome to my presentation on the contribution increase for Discovery Health for next year 2013, as well as looking at their competitiveness in the market. My name is Seppi Venter. I'm a financial planner from Colosseum Consulting, and at the end of this presentation, you will find some contact detail if you need any further questions answered. The great difficulty with any medical aid is the fact that when they consider contribution increases for the following year, is balancing the paradox of growth versus benefits versus their reserves. When one looks at Discovery Health, since their inception in 1992, they have had a phenomenal growth. Specifically over the last 4 calendar years, their membership has grown by more than 20%. Looking at the required 25% solvency margin, Discovery also had phenomenal growth, and the increase for next year means that 2% of the contribution increase would be put aside to make up the additional requirement of more than 600 million rand to adhere to this part of the Medical Schemes Act. Members always complain about contribution increases, but the good news is the fact that Discovery since 2007 have increased their benefits by more than 9.4% in comparison to the actual premium increases, and this most definitely should be good news for members, the man on the street. So, balancing this paradox of growth, benefits and reserves, to recap, since 2009, Discovery has had growth in their membership base of more than 20%. Their reserves have increased by more than 2 billion rand since the same year, and then benefits have also increased in real terms for members. And this brings us to the increase for next year being set at 10.9%. The 10.9% is made up of medical inflation being approximately around 8.9%, adding the 2% that is required for the solvency margins adds up to an average of 10.9. Looking at the various different options, you would note that on your top end plans like executive, comprehensive and priority, the real increase on those options is 11.8%. On the balance of all the other plans at Discovery, those increases are set at 9.8%. And the average over all the various plan types, that's getting to 10.9. Taking this into consideration, it is, however, pleasing to know that Discovery still remains, on average, 5 to 27% cheaper and below the market. When one considers the increase for 2013, the headline increases that were announced, Discovery at 10.9%, MedShield being the lowest at 7.5%, the balance of the schemes, anything between 8 right up to 11%, that's just for 1 year. The real comparison and the fair one would be to also say, let's have a look at the 5-year compounded average increase between all those schemes for the last 5 years. And there Discovery comes in, the lowest being at 10, and there's a scheme even as high as 13.5%. But it's pleasing to note that Discovery for the last 5 years, year on year, have had the lowest compounded average increase. Another good comparison is to also have a look at the various plan types and compare that to the rest of the market. The average family, being husband, spouse, 2 children, would be compared to the rest of the market. And on your lower income plans, it is good to see that Discovery still beats the competitors by 11%. On your hospital plan types, Discovery saves their members on average 5% compared to the rest of the competitors. On your intermediate day-to-day type plans, the plans with savings accounts, Discovery still saves their members 11% compared to the rest of the market. And then on your extensive day-to-day type plans like executive, comprehensive and priority, Discovery beats the competitors by a whopping 27%. And of course, this still remains to be a very difficult comparison because one cannot only just look at rates that is charged on a monthly basis, you also have to actually dig in to comparing benefits of the various types of schemes. In general, most benefit limits, the co-payments, the deductibles, all of those would increase by 10%. MRI CT scans, those co-payments would increase by 6%, which is in line with the tariff increases for radiologists. The annual thresholds would increase on average exactly to what the increase is on the respective plans. Then some good news is the fact that chiropractors are being added to the allied therapeutic and psychology extender benefit, and these limits would also be increased by 10%. The last part of the good news is the fact that on your chronic illness benefit, the medicine list and the chronic drug amounts are being changed and updated to reflect the changes in the prices for 2013, and these would be implemented to the existing members by July 2013. One particular example of changes in the chronic drug amounts is a product that we could look at called Aspavor. Previously, the product sold for a price of 257 Rand, and the price since then has dropped to 110 Rand. The chronic drug amount used to be 110 Rand for members, now being reduced to 105 Rand, and the good news is the fact that previously members paid in a co-payment of approximately 147 Rand, and that has vastly been reduced to a mere 5 Rand 16 on exactly the same product. Some other changes on the chronic drug amounts would see that 63 medications, the CDAs have increased. On 63 other CDAs, they have decreased, and approximately 168 chronic drug amounts would remain the same for 2013. I thank you very much for your time. Please email me any questions or phone me on my cell phone, and I will gladly respond to you as soon as possible.